take every single point of the Viva very, very serious. You get, because you don't know your lecturer now, you don't know what, because Viva is subjective, depends on the mood of the lecturer. So you don't know where your lecturer that day will decide to pick out their marks from. You get. But this particular marking scheme I gave you is general. You get. So maybe the lecturer that doesn't want to ask you general questions. And I forgot to mention, Dr. Sule will ask equipment as his general questions. You get. So things like what is high tension transformer, what is filament circuit, components of main circuit, all those little questions that you can just answer, blah 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 blah, and you are done. You get. Okay. So to the next phase now, I said that I will give you your the pattern that you answer, or you present your case in Viva. So that acronym, you have B, C, 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 E, F. B, C, 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 E, F. All right, did you get that? I'll repeat myself one last time. I said B, C, 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 E, F. You get? So if you follow this particular blueprint, whether you are cut short or not, or whether you finish or not, or whether you are not able to answer general questions or not, at least you have said everything that you are meant to say. Because your lecturer might decide not to ask you general question and say, oh, let me pick this mark from exposure factor. I not mention exposure factor because I said that, because I not mention exposure factor in the marking scheme. You might call you. You get. So which is why you have to follow that particular step by step. B, C, 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 E, F. Though the last C, we might move the last C to radiation protection, because okay, that last, okay, before we go there, the B means beam direction. The B is beam direction. C is the centering point. Oh God. C is the centering point. The other C is the cassette size. The other C, the next C is collimation. So usually, I just mentioned it in this order because it seems alphabetical, right? But this last C, we usually move it to patients to the radiation protection, because the best form of radiation protection is collimation. Collimation to the area of interest. It's just like you saying you will avoid error due to what? Good. So you collimate to the area of interest. Good. So that's your, don't even wait for them. Like Dr. Nakwe now might not ask you your radiation protection, and she wants to give you mark for radiation protection. When she's about to ask you, are you done? And you say yes, you can go. So you might don't miss it out. Okay, don't miss out on that radiation protection. Only say it. And when you mention your radiation protection, don't say stupid things like I will obey Allah. I will use good exposure factors. I will use nice exposure factors. I will use favorable exposure factors. Who told you that exposure factor is favorable? You get, like, if it is Dr. Abo, and you say I will use nice exposure factor, you see, you invite so many questions, like that will now be your general question for that day. You get. So how do you know that this exposure factor is nice? You get. You see, like, you imagine you standing and they ask you, how do you know that the exposure factor is nice? What would you answer? You get. So one strategy in Viva that I usually employ is to avoid as many questions from the lecturer as possible. Say everything you need to say to leave them dumbfounded, so that they don't have room to ask you questions. That way you clear yourself and collect A and move out. You get. So the best form of radiation protection is what? Collimation. You will collimate to the area of interest. Then some other things that you will do while positioning your patients can count for radiation protection. Let's say, for example, you position the patient for dozipalma. You tell the patient to turn their eye away from the area of interest. That's a radiation protection procedure. Let's say you position the patient for chest X-ray and tell them to elevate their jaws. You are protecting the thyroid gland from excess radiation, even the eye. So all those things that you do in position, you note them while you're positioning the patients as extra points for radiation protection. Then include collimation as the third word C. Next, you have exposure factors. Exposure factors, that's E, exposure factors. Then F is FFD. Okay. F is FFD. So you have to remember that BC. So once you walk in, you position your patient. Once you are done positioning the patients, the only time you start talking to your lecturers is when you start, when you are done positioning the patients. While you are positioning the patients, it's not we will drop their hand here. I will, no. No one cares about that. Your own is to instruct your patients. And another thing I will have to mention now, you as a patient or you as a Viva partner, let me tell you the easiest way to get an F while you have not even said anything. Eh? The easiest way to get an F is when you help your Viva partner. Okay, your partner picked chest X-ray, picked a chest exam, let's say picked pleural effusion, and they ask your Viva partner to position you for chest. Go on, you just go there and go and stand. Just go there and position yourself. You walk there, you walk out with an F. You get, you don't, on no account should you help your Viva. You like, you don't know anything about radiography. If your partner says you should come and stand for chest, just go there and stand. The Viva, your Viva should position you for chest. You get, position for hand. Drop your hand anyhow. The person should position you. You get, because if you should drop your hand, they'll be like, this person is trying to help. And I'll give people expo. I don't want this one to show on social media. This one is expo. Because you know, if they want to upload it now, so cut it, off it, off it, off it.